let's see what it looks like. If it looks like it'll be okay for a while, we'll leave it alone. We can always come back at a later date and do that valve through the groin, something called a transcatheter valve. But the mitral valve needs to be fixed or replaced. That's the one that's really hurting you. Okay, and it's causing the elevated pulmonary pressure.
Dr. Sarkey showed us the video, and you could see it just doing
pretty
this.
impressive.
So,
So picture's worth 1,000 words, as they say.
Yeah.
And it's pretty standard.
So you're
repair.
fixing the valve.
I'm gonna try, but my philosophy, and I've been doing this for a long time, is if it's not an easy fix, I'm not gonna spend 2 hours in there trying to mess around.
Replace it.
Well, I leave all his own tissue, and I put a valve right inside of it. Okay, and it works beautifully. And I make that decision at the time of surgery.
Sure.
When I was younger, that you gotta fix everything, and then you spend 2-3 hours, and then you come out and the repair is not perfect, and you end up going back anyway. That's just foolish.
Right.
Okay, because what you want to do in somebody in this age group is you want to expedite the procedure.
Yeah.
There's no messing around. You go in there, you do what you got to do, and you get out.
Yeah.
We're doing this to keep you around longer. Is that okay with you?
Yeah.
Okay, as long as you're willing to do everything you got to do afterwards. Okay, you're gonna feel like a truck hit you for a couple days. It's a big operation. It's major trauma to your body. It's everybody in this unit right now, the majority have had heart surgery, so you don't hear anybody screaming out in pain, do you? Okay, well that's because we gagged them. No. No, I'm just kidding. The pain is controlled, and the nurses will tell you it's pretty standard. If you do what you're supposed to do, listen to the therapist, listen to the nurses. We don't have people, in agony just for kicks. Okay, we give you pain medicine, and it's just a fine line you got to walk between getting too much pain medicine so that you don't breathe, and not getting enough so that also you don't breathe effectively. So it's not, honestly, most people when it's all over, they come back in about a month. The majority say it's not as bad as they thought it was going to be. All right? Because when we cut you here, we don't cut through any muscle groups. If you just feel your chest here, it's just skin, a little bit of tissue, and the bone's right there. So as opposed to cutting this way or in your belly where you have to go through 3 or 4 major muscle groups, this is tolerated very well. Okay, and as long as you don't do any push-ups, you got to stop your morning push-up routine for a while. Okay, all right, and then you bench pressing. You can't do any bench pressing. You're lifting grizzly bears. Okay,
we won't let them do that for a while.
You got to wait for a couple months to let your bone heal. Okay, but after that, you can do whatever you want, sir.
How long will he be in the hospital after, or does that?
After surgery, I would say 5 to 7 days.
Okay.
Some people surprise me. Some people go home earlier, but it's a big operation.
Sure.
And I'll tell you afterwards everything that happened and what to expect. We need to tune him up a little bit more, get rid of a little excess fluid, make sure we try to get his pulmonary pressures down a little bit. So
which is why surgery is not till Wednesday, right?
Yeah, that's exactly why. You don't want to go in surgery and go, oh shoot, I wish I had waited longer.
Yeah.
Right. So you want to get him as tuned up.
Yep,
as
he's
possible.
going to do what Brittany tells him.
Yeah, you are. Okay, buddy. You have any questions about anything?
Yeah. Were we going to ask anything else?
And you've got 5 days to think about it.
It's not a
okay?
pig valve,
And you'll
right?
see me. It's a cow valve. If I use it, it will be a cow valve. Yeah, if I repair it, it's his own tissues. If I replace it, it'll be a cow valve. It's a really beautiful valve made by Edwards. Well, he doesn't like pigs.
No, he wanted it to be a pig valve for some reason.
No, I won't put a pig valve in it. I did. The results for this new cow pericardial valve are pretty impressive. So that's what I would want in me. Okay,
but you won't know that till later. So
I won't know that till the time of surgery. Okay. All right, buddy.
Do you have any questions?
Will you come by every day, sort of, just in case we think of anything else?
Absolutely, yeah. And if not,
And we're around.
Nurses know how to get me.
Okay.
Okay.
Yeah.
All right, guys. Nice to meet you.
Thank you
I'm
very
sorry,
much.
I don't know if I
that's okay.
introduced you. Sorry.
Yeah, no problem.
That's my